Bereavement is the state of loss when a loved one, such as a parent, child, spouse, or close friend, has died. Grief refers to the psychological reaction to the bereavement. There are many different reactions to grief, and no one pattern fits all people. About 30% of people experience a relatively mild distress in response to the death of a loved one. They are able to quickly accept the loss and resume normal activities. 30% of people experience waves of high distress, and another 30% fall in between these extremes. They experience a moderate distress. 10% of people appear to experience a delayed grief about 6 months after the bereavement. The normal grief response can be very intense. Symptoms may include waves of sadness, sleeplessness, fatigue, poor concentration, and loss of appetite. The idea that grief occurs in stages is common. Some experience an initial stage of shock or numbness. This is followed by a period of an increased depressed mood and a yearning for the loved one. Generally, acceptance of the death increases towards the end of the first year. The yearning, sadness, and anger gradually diminish. There is no straightforward answer with regard to how long grief may last. It varies by person, circumstance, and culture. We are not meant to forget loved ones, and memories of a person may be present for years. Increasingly, grief experts suggest that a sense of a continued relationship with the deceased is normal and healthy. The resolution of grief does not mean forgetting the deceased person or lessening our affection for them, but one is expected to resume normal activities. Grief is typically only considered a mental health issue if it becomes excessively prolonged. About 7% of people experience a prolonged high level of grief. In a prolonged, complicated grief, the individual continues to yearn for the deceased and remains withdrawn from resuming normal social activities. They may feel numb towards others, feel lonely, and have difficulty acknowledging the death. When these and other symptoms are excessive and interfere with everyday functioning, then grief is seen as problematic. However, grief is not an illness and usually does not require medication or psychological treatment unless safety issues emerge. Treatment of grief should be approached with caution. It is not necessarily desirable to eliminate grief, which is part of a normal emotional adjustment to the death of a lifelong partner or loved one. When psychological intervention is provided to a prolonged grief, at least 6 months following the bereavement, there is evidence of moderate but lasting benefit. Cognitive behavioral therapy, cognitive processing therapy, interpersonal psychotherapy, brief psychodynamic, or other effective psychotherapies can be used to help a person engage in activities and think about and understand the impact of a loss. Cognitive behavioral interventions are used to help people gradually return to their daily routines. You can consult with a registered psychologist to find out if psychological interventions might be of help to you.